आसमा नाम बताया
जी, आसमा ही आसमा।
आसमा
Sir, age 26.
now this obstetric ultrasound biparietal diameter corresponds to the gestational age of from outer to inner 33 weeks. It measures 8.4, which corresponds to the gestational age of 33 weeks. Now this is the chest. These are the lung tissue. This is the chest area. This is the diaphragm. This is the liver, and these are the veins, hepatic veins. This is the heart. Here you can see the four-chamber view. If you can get it. This is the four-chamber view of the heart. So the cardiac activity appears normal. This is the stomach bubble. This is the urinary bladder. The placenta is anterior wall. This is the placenta, and this is the chorionic plate. This is the amniotic fluid. Now, what is the femoral length? Now, there is some problem in my migraine. Here's this one. Well, anyways, the female length corresponds to the gestational age of 30 weeks. 29, 30. Now the point to remember is that at 34 weeks plus, one should always rely on the female length as the gestational age, and they should not rely on the biparietal diameter regarding the gestational age. Now in this case, the female length is 5.6 and it corresponds to the gestational age of 29 weeks, 6 days. So I will go by female length and I will discard the biparietal diameter, because at 29 weeks one should rely on the femur more than any other. measurement. Stop to. Now this is the transverse section of the abdomen, and let's see that what is the measurement by this transverse section of the fetal abdomen. This will give us the weight as well. Femur length plus abdominal circumference gives you the weight of the fetus as well. Now this also corresponds to the gestational age of 29 weeks. Abdominal circumference 256, 29 weeks, 6 days. So femur length and abdominal circumference are equal. They say 29 weeks. Fetal weight is 1503 grams or 1.5 kilograms, and the expected date of delivery is 4th November 2012. We did saw that the placenta is anterior wall. This is the placenta, and here we see that the fluid, amniotic fluid, is normal for the gestational age. There is no this is the urinary bladder. This is the stomach. This is the liver. This is the stomach bubble. This is the gallbladder. This is the liver. And this is the heart. Here you can see that this is the diaphragm, the chest. This is the chest. This is the heart, the lungs. This is the liver. This area is the liver. Okay. And this is the fetal head, which shows movement. Here you can see the movement. So fetal movements are seen that ideally should be seen by the movement of the limbs. Here these are the limbs. You can see that the movement we can see the movement. This is the longitudinal section of the body of the fetus. Cardiac activity. In a post-camera view is (144 to 150 beats per minute at the time of ultrasound). Now, this is a normal pregnancy of 26 weeks, 6 days, with no abnormality seen. Normal pregnancy, anterior placenta. Now we come towards the gallbladder. Here is the gallbladder. She came with the complaint of fever, high-grade fever, as well as pain in the right hypochondrium, and you can see that the gallbladder is full of sludge. This is the anterior wall of the gallbladder. This is the fundus of the gallbladder, posterior wall, and you can see that this all echoes within the lumen of the gallbladder, suggestive of sludge within the gallbladder. Normal gallbladder lumen is black, as you see this area. So the gallbladder is full of sludge, and you can see that there are tiny echogenicities. These are cholesterol see the status of the common bile duct. Now this is the portal vein and this is the common bile duct. The common bile duct measures 3.0, so the common bile duct is not dilated as it should not exceed 7. Patient's common bile duct measures 3.0. So, and there is no evidence of intrahepatic bile duct ectasia in the right lobe or in the left lobe. This is the left lobe of the liver as well as the right lobe. You are seeing both the right and the left portal veins. This is the right portal vein, left portal vein, ascending part of the left portal vein, anterior right anterior branch, left anterior branch, and here comes the left anterior branch entering this one. And there is no evidence of intrahepatic bile duct ectasia. Now we come back to the beta. Gallbladder with patient in left lateral decubitus posture. Let's study the gallbladder with patient in supine posture. See, it is full of sludge. No doubt about that. It is full of sludge. The wall, this is the anterior wall of the gallbladder, should not exceed more than 4, and it measures 4.3 millimeters, and this is very much suggestive of cholecystitis with sludge. And there are calculi. लंबा सा बेटा लो, रोको, लंबा सांस लेके सांस रोक लो. And here you are. No, बेटा सांस ऐसे रोको, रोको.
सांस लेके रोक लो.
Okay. Now this is a very thin layer of tiny 1 millimeter to 2 millimeter calculi laid out with the posterior wall of the gallbladder, giving posterior shadowing. There are calculi in the gallbladder as well. However, there is no evidence of gallbladder outlet obstruction, and here we see the pancreas. In all such cases, pancreas should be seen. So this is the pancreas. Pancreas is normal. This white band of tissue is the pancreatic body. This is the splenic vein, and is there any lymph node at the region of the porta hepatis? Now this is the region of the porta hepatis. This being the portal vein, the common bile duct. There is no evidence of any lymph node in this region. So, no pathology relating to the pancreas in this 24 weeks pregnant female. No para-aortic plan lymph node enlargement seen. Okay. This is the लंबा सांस लो बेटा, रोको. Transfer section of the gallbladder. बेटा सांस लो, रोको. Now this is the transfer section. See the wall, these are the calculi. In fact, this thick white line is those of calculi. This is the transfer section full of, now the gallbladder is full of sludge with the calculi in it. Now there you see, here, now the calculi have moved down into the neck region and collected together, giving posterior shadow. So the wall is thick, the lumen is full of sludge, and the patient is pregnant with 26 weeks pregnancy. She is 26 weeks pregnant. This is the fetal head. This is the liver. Liver is normal. This is the gallbladder, full of sludge, and these are the calculi, all of them. This is the shadow from the calculi. This is the fetal head. There is one more finding in this patient, which is that the right kidney shows hydronephrosis. Here we are. This is the right kidney. See the dilation of the calyces. Number one. Number two, see that the echogenicity of the parenchyma is raised, is more as compared to that of the liver echobrightness or echogenicity, which is opposite to that of the normal. Normal is that the liver is more echogenic than the parenchyma of the kidney. Now here it's opposite. The parenchyma of the kidney is showing brightness which is much more as compared to the liver. So there is a globally increased parenchymal echogenicity of that of the right kidney with prominent pyramids. Now this is a pyramid, and with hydronephrosis. This hydronephrosis is due to the pregnancy, pressure of the fetus on the right ureter. These dilated areas are the calyces, upper fold, mid region. This is the pelvis with no calculi seen. Now this was the gallbladder with calculi, and this is the kidney. So this is a case of normal 29 to 30 weeks gestational age pregnancy with empyema of the gallbladder leading to acute cholecystitis. Thirdly, there is minimal to moderate degree of dilation of the right renal calyces with prominent pyramids and diffusely raised right parenchymal echogenicity, which can be because of the pressure of the fetus on the right ureter and the echogenic changes of the parenchyma can be due to UTI or some infective process. Thank you.